My name is Efren Colazo, and I will be presenting the anxiety and panic attack presentation. To have a deep understanding about panic attacks or anxiety attacks, we must discuss first what is an anxiety disorder. Anxiety is defined as a vague and troubling feeling of discomfort or fear that is accompanied by physiological symptoms. The source of this discomfort is often non-specific or unknown to the person affected, which generates apprehension caused by anticipation of danger, which enables the person to think that they would deal with a supposed threat. Anxiety disorders are the most common group of mental disorders worldwide and the sixth leading cause of disability worldwide. Common onset between early adolescence and young adulthood, with majority not receiving mental health treatment for their symptoms, which is a problem because there's going to be a high prognosis of a patient to have a worse anxiety disorders in adulthood because it's not receiving proper care or proper treatment when they are young. Continue with data information. Likely occurrence in girls and boys and have been associated with low family socioeconomic status and with parental internalizing problems. So that one of the findings that you can see under history. Early signs, behavioral inhibition or shyness, temperament dimensions as frustration, effortful control, or higher body mass index because the patient really believes that is not satisfied with the body and everyone is going to make fun of him or her. So that's one of the early signs probably that you're going to be suspicious about developing an anxiety disorder. There's different diagnostic class of anxiety disorders, and it's very important to know that because after we have recognized those kind of anxiety disorders, then we can see what are the possible triggers of it. So the first one is separation anxiety disorder, which is an excessive discomfort when living a separation from home or people to whom you feel attached. The second one is social anxiety disorder, which is a fear or intense anxiety in one or more social situations in which the individual is exposed to possible scrutiny by others. The next one is specific phobia, fear or intense anxiety about a specific object or situation. So depending on the phobia, you got the name. In this case, this is a patient that have a phobia to needles, as you can have phobia for heights. Generalized anxiety disorder. This is a disorder when you feel intense fear or anxiety where there is no specific trigger. So suddenly you start to feel some anxiety without any reasons or knowing what are the triggers of it. And finally, we have panic disorder, which is our main topic. We're gonna be discussing about that and when we found some panic attacks or anxiety attacks. Some of the signs and symptoms of anxiety disorders are feeling restless, wound up, or on edge, being easily fatigued, having difficulty concentrating, being irritable, having headaches, muscle aches, stomach aches, or unexplained pains, difficulty controlling feelings of worry, sleep problems such as difficulty falling or staying asleep. And now we're going to discuss what is panic disorders. A panic disorder is an anxiety disorder characterized by anxiety attacks, accompanied by physical and affective signs and symptoms, which appear abruptly and reach peak intensity within minutes. These attacks tend to be followed by anticipatory anxiety, for example, fear of suffering another crisis and/or persistent apprehension about the consequences of panic disorders. Prototypical expression of a fear responds to an acute internal threat stimulus as a response to potential harm within the negative valence system. Symptoms of panic attack, they are kind of the same as an anxiety disorder. The only thing is that you have these unique signs and symptoms as depersonalization or fear of death. Between both of that, fear of death is the most important one because that's the unique symptom that makes a typical panic attack or anxiety attack. When we're talking about agoraphobia, this is the situation that the patient feels that there's no place that he can move or a place that's gonna be safe. Everything is gonna be hard for him or her. So agoraphobia has been moved from panic attack or panic disorders, and now it's a different kind of anxiety disorder. Let's talk about sports performance anxiety. The most common form of athletes' anxiety. Estimates suggest anywhere from 30 to 60% of athletes experience sports performance anxiety. And it is an intense fear of poor performance at a sporting event, viewing competitions as threatening and respond with tension and stress in the body and mind. Signs of symptoms of this kind of disorder is shaking and trembling, racing heart, hyperventilation, overthinking, self-doubt, and low self-confidence, which is one of these different or unique symptoms or signs. Gastrointestinal upset and subsequent bathroom issues, muscle tension, lack of focus, and fear of failure. Differential diagnosis of anxiety disorders or panic attacks. Medication-induced anxiety because those medications could exacerbate those symptoms and are kind of the same. It's very important to know that differential diagnosis of anxiety disorders is very difficult because there's a lot of signs and symptoms that you can see in other conditions or disorders. So that's the challenge in here. Seizure disorders could be another differential diagnosis. Heroin abuse, somatoform disorders, especially pain disorders, which you can interpret as an anxiety or a panic attack signs and symptoms, sleep disorders, and thyroid problems. When we are going to manage a panic attack, the most important thing is try to get the patient on real life. Let him or her know that everything is going to be fine, that no one is going to die for a panic attack, and you're going to try to make the patient to feel of the real life. So one of the things that we can do is what is called the 5 steps to end a panic attack. The first step is acceptance. Encourage the patient to accept the episode. Don't ignore the attack or try to fight it because that's going to increase cortisol, and the exacerbation of the symptoms are going to be more intense. So encourage the patient to accept the episode, assist the patient to accept the episode. You can say, hey, repeat with me. I'm anxious right now. I'm having a panic attack. It's okay. It's just anxiety. There's nothing wrong with that. And also remind patient that he or she is not going to die. So no one is going to die from a panic attack. So repeat with me. It won't hurt me. The second step is a slow down breathing technique, but it's called the 2-4-7 technique. And what does that mean? Well, it's a breathing rhythm. When you get a breathing in the count of 2, then holding the breath for the count of 4, and then exhaling to the count of 7. And you're going to repeat this process for at least a minute or until you see that the patient is calmed down. Make a point to concentrate on counting. It will help to minimize intrusive talks. And once the patient is more calm, or if you have experience with it, maybe you can have the variation of 4-7-8, which is the same technique, just holding, breathing for 4 seconds, holding it for 7, and then exhaling for 8. The next step is getting the patient back in reality. That's the way to encourage the patient to replace the negative and emotional talks with realistic talks, trying to make a positive environment and avoiding that negative talks invade the patient. So talking out loud, journaling, and remind the patient again that nobody has gonna die from a panic attack, and the feelings will always pass. Repeat step through the breathings through this process. The next one is touch physical surroundings, where you encourage the patient to employ physical senses, making it having those senses again, letting the patient know that he's alive and try to feel the same things as a human being. So list a few things you can see, touch, smell, taste, or hear. Go from object to object and use your hand to feel it, concentrating on the reality of the object, and always remember to continue the breathing steps. And finally, review the situation. It's important to make the patient to analyze the case and get more educated about it. What are the typical tendencies of his or her panic attacks to then have a proper management or probably to have more advanced treatments. So for that, now that you have calmed down the patient, it's completely normal to feel tired and be wilder. So you can say that to the patient. Assist the patient with writing down possible triggers for the attack. Do you drink coffee? Are you stressed about the situation at home? Just trying to look for some question to understand what was the trigger and what we can do furtherly. And finally, encourage the patient to keep a journal to see if there's a pattern in them and refer patient. Prognosis of anxiety disorders or panic attacks. First, we start with chronic progressions, when the patient can have results in economic burden and a loss of quality of life. Strong association with some cardiovascular diseases. And as you can see, there's a high comorbidity, 15 times higher compared to healthy individuals' rates. Substance misuse and depression, which is really high related to anxiety disorders. There are a great rate of comorbidity between them. There was a study of Meyer in 2016 when they investigated the increased mortality rate ratio between anxiety disorder patients. The study mortality rate ratios were analyzed on anxiety disorder patients for 10 years period. Uh, they checked for natural causes of death like accident, suicide, homicide, and natural causes of death, respiratory disease, cancer, digestive conditions, cardiac diseases. The results of the study showed a higher mortality rate ratio for natural causes of death and unnatural causes of death compared with individuals without anxiety disorders. Most persons diagnosed with anxiety disorders die from natural causes compared to persons diagnosed with depression. Significantly elevated mortality rate ratios for all specific causes of death among individuals with anxiety disorders compared with the general population, with the exception of cancer. And persons with comorbid anxiety disorders and depression present a higher mortality rate ratios for unnatural causes of death, deaths caused by accident, and strikingly high amounts of suicides. Referral. You can refer the patient to professional counselors or general practitioners to try to have more conservative treatments. But then if you don't have effectiveness with that, then you should refer to clinical psychologists or psychiatrists. This is a consensus statement reported by the Journal of Analytics. Some steps that we should do for the referral process. Encourage the athlete to seek for professional help. Once agreed, referral to a mental health care professional should be completed as soon as possible. If possible, the athletic trainer should help the athlete make the initial appointment. Treatments for anxiety disorders, cognitive behavioral therapy, cognitive behavioral group therapy, and mindfulness interventions are going to be good for that. Some pharmacological treatments, although there are reports that the side effects can be detrimental to the patient because it could be an obstacle for adherence to treatment. Self-guided trying diagnostic internet cognitive behavioral therapy. This is a way that patients have self-education about it, and maybe they can manage their own case with better effectiveness with help of others. And neuromodulation techniques such as transcranial magnetic stimulation. Herbal products and dietary supplements could be used, but they are not regulated by FDA, so you should advise the patient to be careful with those kind of treatments. Clinical cues of emergency care. Obtain and have available in the plan the institutional protocol for emergent mental health evaluations, and always stick to the protocol. If the athlete appears violent or acts violently, call campus or local law enforcement and seek immediate assistance and act to protect bystanders from harm. Safety first. If the athlete is potentially suicidal or not violent, do not leave him or her alone. Call for assistance per the institutional protocol. Offer to accompany the athlete to the place of evaluation, which may help to reassure the athlete during the process. Seek advice and assistance from the administration or general counsel on contacting the athlete's family and informing them of the incident. And those are my references. Hope that you have enjoyed, and thanks for your attention.